Okay, so once again, welcome everybody to our Wellness Committee meeting for January. I'm Dave Statlander, for those of you who don't know me, and I'm one of the co-chair people of the Wellness Committee, along with Lisa Ostrowski from Food Services and Alice Clements. We have a few presenters today. I'm going to start off with members of our HOSA club, which is I believe, co-supervised by Ryan DeGear and Sarah Bruno. And I'll let those folks introduce themselves. And I think they might even have a student with them that might speak on behalf of the club today. And so Ryan, if you wanted to kick things off, go ahead.
Yeah, thank you, Dave. So yeah, our club is HOSA, Health Occupation Students of America, and Sarah and I are co-advisors for it. And I don't see any of our three co-presidents in here, but that's all right. We'll figure it out. But our co-presidents, Alina, Deepak, and Priyanka, it came to us last year, and we're looking to start it up. They're just three really good students who are interested in health and kind of just looking at different ways to go more in depth with it. And they brought this idea. I think they had done it in the past here. So it was kind of revamping it a little bit and looking into more or some more different things that we can do. But really, they kind of take the lead on it. It's really student driven and kind of all their ideas and things. It's kind of whatever they want out of it, like what in depth and different things they want to look into different health careers. For example, like they've done a couple different competitions and stuff throughout the year. They started it off, they did an activity where they gave 10 different parts of the body, whether it was like liver, stomach, heart, and they used Play-Doh and they had a picture up on the board and they had students go through and see which group could do it the best. Unfortunately, I got the bad straw and had to be the judge and the person that got to make everybody mad when I didn't choose their group. But it's just really cool ideas that they get to do together. And again, it's them learning about the body and learning more in depth about different health stuff. They've done different Jeopardies. They've done different Kahoots. They had a medical student from Albany Med come in, and she actually had been all over the country. She grew up in Minnesota. She did her studies in Minnesota and was talking to them about what college looks like as far as the health profession, how to go about like your certifications and different things like that. So I think it was really cool for them to be able to look into that and see how that looks like for them in the future, if that's something they want to do. And they had a ton of questions, and she did a really good job presenting for them. And I thought that was great. Our students had looked into possibly going down to the Bone Museum. So we're looking to fundraise for that and look into just give them different avenues to look at health under a different scope. And that's something, being a part of the health department up at the high school, that's something we'll possibly be looking into in the future as well, is going more in depth into the health or health world and going more in depth with stuff. So there's 27 students in the HOSA club. It's a nationwide club and nationally recognized. So it's just another opportunity for kids to stay after school. We try to meet twice a month bi-weekly and just period after school. And they come up with some different ideas and different things and different topics they want to touch on as far as under the health world. So that's kind of what our club is. And Coach Bruno, do you want to add anything to that? I know Coach is driving, so it might be a little bit hard for her right now. But
no, this is just a wonderful club. I've enjoyed being a part of it, and just also exploring that. They think it's just about being like becoming a doctor, but it's that wide umbrella of medical and wellness and health. Different health occupations. So just having the few meetings that we've had, the students have really got to understand there's more than just a doctor or a dentist or something like that. They could go into laboratory studies and find, we talked about vaccines and going into something local here like Regeneron and just the wide scope, what health occupations really means. Does it go into community health, which is also, you know, what our wellness program, our committee here kind of tries to do, is incorporate that community. So just a really neat club, and it's very student driven, and that's the fun part of that club too.
Excellent. I don't know if I've admitted 3 or 4 more, I think they're students since you started talking. So I'm not sure if any of those committee members that are on right now are members of the HOSA club.
I don't see any on here, but that's
Okay.
all right.
No worries. I just wanted to put that out there. Well, thank you, Sarah and Ryan. And along those lines, I'll share with you is that actually Ryan and our 2 other high school health teachers, Sam Halpern and Tyler Catalafamo and I have spent some time during midterm week this week. We did a Zoom meeting with health teachers down at Mahopac High School that I met out at the New York State AFRID conference. And they're doing some really innovative things down there. They have a college in health program or a college health education program where their students earn credits through what was it? I want to say Fairfield, but what was the name of the college, Ryan? You're muted. It was a college out on Long
Linking
Island.
on it too.
Yeah.
I just had it up.
Anyway, it's like a collaboration, you know, like college in the high school type program. And they also run another one where they partner with Oasis on a substance use disorders treatment and recovery program where students can earn credits or units of study towards becoming a mental health counselor or a substance abuse counselor. And so that's an area where there's certainly a big need within our community, within the state and country. So we're doing some legwork to see what it would take to start introducing a program like that here at here at Shaker High School in the future.
Farmingdale, that's what it was.
Farmingdale is right. Thank you. Yeah, so Farmingdale is who they partner with. And we're looking at possibly doing it with one of our more local, either community colleges or SUNY Albany or a place a little closer to home. But you know, Farmingdale is an option should we strike out locally. All right, before we move on, don't be shy if you wanted any questions or comments you wanted to make. I can't see everybody, so you would need to unmute and start speaking. Otherwise, we're going to move on to
I just
Jeff.
wanted to quickly say, this
Sure.
is Coach Carino again, that we are still trying to brainstorm some good local field trips. So if anyone on this committee can think of anything, health occupations or something that we're just forgetting, that would be awesome if they want to share that or email one of us, Ryan, because we want them to go somewhere and do something out of school. We're just still trying to brainstorm it because maybe the Brooklyn Bones Museum might be too far, too much. So just always looking for helpful ideas.
Yeah. And I would say for those of you out in the virtual world that might watch this after the fact, feel free to contact me and, you know, via email when I send out the Zoom recording, if you had some contacts or, you know, maybe some possible guest speakers that come in. I know we have quite a few families in our community that are in that field. All right. So now I'm going to introduce Jeff Jill. Jeff is I believe the director at the Colonie Center. And Jeff, I'll let you correct me if with the specifics of that.
What's going on, everybody? Thanks for having me and hearing my story. My name is Jeff Hill. I am the facility director, center director of the Colonie Center. My background is in strength and conditioning. I got fortunate to play Division I baseball right out of high school. I ended up transferring colleges and ended up playing Division II rugby, and then went pro about 3 or 4 years after that. Got hurt, ruptured a couple discs in my neck, so I was medically retired. And then I went to graduate school and got my master's in exercise science with a focus on strength and conditioning. Since then, I worked as a strength coach, worked my way up to a head strength coach at 3 separate Division I colleges in North Carolina, and made the move to New Jersey, where I undertook the role as an assistant director and head of football operations for a private sector company called the New York Sports Science Lab, where we utilized a boatload of tech to basically advance anything and everything we could performance wise, from anything measurable, pre and post test variables, and anything from it could be working a punch or the punch speed and rotational velocity of a fighter, all the way to increasing vertical jumping skills and rotational velocity within high caliber figure skaters and everything in between. Previous to that, actually, I worked as a director of athletic and sport performance at the United States Performance Center in Charlotte, North Carolina. Again, another private sector job, but it was super cool because we focused on youth strength and conditioning. So I didn't specifically go to school to work with youth population, although it became a niche that I fell into and felt like I did a pretty good job in utilizing experience and knowledge to increase anything and everything from we had 7-year-old gymnasts and all the way up through we had 6 Olympians there. So selfishly I kept myself to work with the high level athletes. So we had multitude of NFL, MLB, MLS. Pick your 3-letter acronym. We worked with them along with Paralympic athletes. So then fast forward to there, that's when I worked at the New York Sport and Science Lab and into an athletic director position. And now I have undertaken this role at the Sakati Center, which they, if you're unfamiliar, it's very similar to like a YMCA, although they offer a multitude of programs in which my background is something that I wanted to bring in. So I've now begun utilizing all of the members and outreach to begin youth strength and conditioning and youth programming as well. It sounds like I'm in the right group because everything you guys are speaking to is kind of my wheelhouse, my interests, things that I like. I taught the internship curriculum at the United States Performance Center, and in grad school I was the president of the Exercise Science Club. So we ended up bringing some of the best power lifters in the world. Jen Thompson, I don't know if anybody's familiar. She's like a 15-time powerlifting champion, and Dr. Gray Cook, he created the FMS everything. I'm CSCS, RSCC, both distinguished, which shows you have 10 years in the field. Certified. I'm FMS, USAW level 1, and PN1 certified. So my world is strength and conditioning, youth development, health and wellness. I even taught anatomy and physiology and exercise physiology in graduate school. So anything and everything encompassing anything in human performance or the pathway of knowledge of the human body always piques my interest. And now I'm at a position where I'm doing my best to give back and teach. So within this group, please feel free to contact me for anything and everything. I'd love to do any kind of community outreach. If your schools have combines, I can help do the gambit. So please utilize me for anything and everything that can be useful to you, your committee, your group, your club, whatever it may be.
Great. Maybe if talk a little bit about like the programs, like if we have a lot of students on the committee and that will receive this email, like if a student wanted to participate in different things at the Sakati Center, Jeff, how would they go about doing that?
So again, we have a multitude of programs. So we can start with aquatics. So we have 3 pools, well, 2 technically. One's like a splash pad for the kids. So moms and dads, if you want to bring the kids in, they can go play at the little splash pad. If kids want to get into something like mentoring, helping, any kind of assisting, we have group swim, we have private swim. If you're in a population where it could be a club that needs a place for the swim team to come across or have a place to practice, and anything in between there. A lot of mentorship programs within our rec programs, which include basketball, flag football. I just introduced futsal, which is, kind of a version of indoor soccer, if you're unfamiliar. We do we're bringing it back, baseball camps, and I intend to bring youth rugby, like a grassroots rugby development for the youth. So anything that involves volunteering, learning, mentoring. We also work with, and we have separate, like within the rec programs, basketball programs that work with special needs kids. My mother is a special needs teacher for 40 years. So I've got, I've participated and helped and volunteered in 3 Special Olympics, and our community outreach is vast there. So anything encompassing a sport that I just mentioned, and or we call them buddies. The school wants to come help with like the Shooting Stars program, which is where we get special needs members of the community together to help with basketball. You can help with volunteership there, and or skills development as a coach, and or I'm also there beginning a mentorship program when it comes to strength and conditioning as far as the basics. CSCS was at one time the gold standard for anything strength and conditioning. So I teach a prep class. It teaches you how to periodize, how to prepare. We do something called Eat to Perform. So along with just lifting weights and speed and agility, I also teach proper game time nutrition, things called ergogenic aids, which is any legal supplement and or food that increases performance. So if it's knowledge that your group or club is needing, I provide all that. If it's volunteership, there's opportunities for that. If you have special needs outreach, we have programs for that. If it's honing your skills on coaching or as a player for basketball, flag football, swimming, soon to be rugby, or if you want to learn the basics of strength and conditioning, proper movement mechanics, how to progress correctly based upon training age, which is basically how long you've been in a gym. Literally, I wrote my thesis in graduate school on squatting. So if you want to get your legs stronger, proper movement mechanics for that, I also teach that as well. If you're interested in personal training, we also offer personal training and small group training. So if your club or group or just you personally, once that's the field that you want to go into, we offer shadowing. And again, I'm in the process of creating all of the volunteer outreach and anything in between. Soon to be next year, once I get all this done, I plan to start offering combine opportunities, how to run them, proper ways of measuring the metrics, input, outreach to Nike through their combine association. Anything, like I said, anything and everything that you could think of, 94% of the time, I'll have an answer or I can find someone that does. If you're more along the clinical side, we offer medical integration programming. So what we do, we have something called a MyFitRx program and a Kids on the Move program. Same programs, different age groups. One is for adults, one's for kids. But basically what happens is we identify a pathway. So a pathway could be diabetes, weight loss, stroke, any kind of return from those to physical movement in health and wellness. We collaborate with the medical community across the board, where as long as you're certified by the state of New York, could be a physical therapist or it could be orthopedic surgeon, anything in between. We work with patients to get them back to normal life almost when it comes to exercise. So we offer a humongous medical integration program. We're MFA certified, which is very few and far between, especially for a facility like mine. So like all encompassing health and wellness. If there's a question you may have, we either offer it, or I'll find you the right pathway to pursue whatever it is you may be in search for.
Outstanding. So, I'm going to open it up to the committee for questions and comments. I will say you hit on some things that are very intriguing to myself as the supervisor of health, physical education, athletics, because, we have Sarah Bruno, who was speaking before about the club, is our unified physical education teacher. It's a program we added this year. It's a conjunction between our students with in our adaptive physical education program and our general education students who have become their partners. And you mentioned about your mother being a special education teacher, and maybe we could have a separate conversation at some point to see if there's some ways we could collaborate on things like that. You mentioned like nutrition. That's something that we're been talking quite a bit about having some guest speakers or making that more of an emphasis for our students and our student athletes. So, I think that you and I could, and perhaps some others that have an interest in the committee, could have a separate conversation about that as well.
Absolutely. I'm a firm believer in giving back. So, there's a plethora of knowledge and experience, excuse me, that I've been very blessed and fortunate to come across. I've been put in some really good situations with some really good mentors that taught me, open-mindedness and, the sharing of knowledge and showing that knowledge is power. So I've tried to hone my craft to the best of my ability and use that to utilize to teach and also implement. Bridging the gap between theory and practicality is kind of a specialty of mine. So the last thing I was going to touch on too of offerings is I do a lot of research, read a lot of research, 5 to 8 studies a week, and find a way to bridge the newest research into practicality amongst whatever demographic or population that it may apply to: athletes, special needs, whatever pathway, like I was discussing before. So I think learning, especially for a high school population, learning how to read research is something that I could also offer as well, especially to utilize within their specific practice.
Fantastic. All right, before we move on to our next speaker, does anybody have any questions or comments for Jeff? Again, I can't see everybody and I don't see, not a lot of cameras are on, so you gotta unmute yourself and speak up. All right, Jeff, thanks a lot, and I'll follow up with you with some of the ideas that we might have.
Absolutely. Thank you, guys. I appreciate your time.
Thanks.
Mhm.
All right, so next we're going to hear from a couple of students. We have two different presenters here, or two different groups. We'll start with Pragna Abidi. She's going to talk about the National Alliance on Mental Illness 5K.
Did I share my screen?
Yep, absolutely. Let me make you a co-presenter.
Thank you.
All right, you should be good.
Okay, thank you. Can you guys see this?
Yep, just came up. Yep.
Okay, so I was thinking to collaborate with the National Alliance on Mental Illness to like host a fundraiser in like April or May. We could have like a 5K run or like a shorter distance depending on like the preference, and it would be open to all grade levels. And this would like raise awareness about mental health at like an early age, especially if it's open to like elementary kids as well. And I was wondering if anybody would want to partner up and like actually make this idea or like make this event happen. And yeah. And if you want, I can share the agenda with you guys as well.
Yeah, if you could email me, it looks like you, so just to give a little background, Pragna brought this idea to me and we met maybe 2 weeks ago, a few weeks ago, and
Yeah.
talked about some of the, logistics of organizing a 5K. And we had a good discussion about it, and she's been doing she had done her homework as well. And it looks like she's put together an informational sheet or a volunteer sheet for people that would like to collaborate. So, Pragna, if you want to share that with me, I can then share it out to the committee because they won't be able to click on the shared screen.
Yeah, I think I already shared it with you.
Okay, I already have it. Okay,
Yeah.
I will be sure to include that when I send out the recording.
Great.
Later.
Yeah,
Do you
thank
want
you.
to? Did you want to talk a little bit about the tentative plans, or you were kind of honing in on some details when we last spoke. I didn't know if you had anything
Yeah.
else to share. You were talking about
Um,
possibly partnering with another group in the school.
I was trying to partner up with student council, but they already have the color run going on, so I don't think we could do that this year because that would be too much for student council to do.
Gotcha.
So I was hoping for like another club that would want to partner up with this or like a teacher that wants to make this happen.
Yeah. Okay.
And
Well,
we
we
were
do. Yep. Go ahead.
Yeah, and I was thinking to do like the Mohawk Colony Town Pool, but like you said, we can't do that because there's a lot of logistics behind it. So, like around the high school itself or like around Blue Creek would be great if we could do it.
Yeah. I think we were
And then,
looking at targeting like a Saturday, right?
yeah, in like April or May. And then
Yeah.
I also attached a link that like shows how we could fundraise for the mental health place, and you just have to put your campaign and what it does and how much money we raise from the 5K or just the event.
Excellent.
Yeah,
Yeah, so I
and
know
that's budget.
if there's anybody that's on the committee now that would like to ask some questions that's on the Zoom or in the virtual world, can always reach out to me. But if we have some people here that had ideas or suggestions that you want to discuss at this time, you're always welcome to speak up. But I will share out that information, and we can have follow-up conversations as we start to get some people come forward, Pragna, and
Okay.
we can get some people interested that can, we have a lot of coaches, I think, that could help you out with this, and I can help you with the facilitation of it.
Okay, thank you. Thank you, everyone.
All right. Okay, next we have Akshita and Bhavya. They're going to talk about their civics engagement project that they have going on.
Could I have access to share my screen?
Yep. All right, Akshita, do you need it as well, or just Bhavya?
No, I think Bobby can share his screen.
All righty, you should be good.
Okay, I just want to make sure that everyone can see my screen.
It came up, so you're ready to go.
Okay, so hi everyone, I'm Bobby, and I am partnering with Akshita, and we're thinking of proposing a fitness challenge. So, as we mentioned, we are Akshita and Bhavya. We're freshmen at Shaker High School, and we take an elective called civics/leadership. And what we basically do is we're tasked with like choosing a community issue, which we plan to take action over the course of the year. And then currently right now, me and Bhavya are working to support underserved populations in our district by hopefully establishing a school-based health clinic. So that's still in the works. And to back that up, we also wanted to partner with the wellness committee to present our program initiative. And so overall, we just hope to work with you guys. Okay, so we were hoping to start a 30-day fitness challenge, and it would be a program designed to motivate and inspire or enhance your well-being. We sent out a Google form, and a lot of the responses we had were to hopefully see a fitness or nutrition class. So we were hoping that this project would aim to address these ideas. So basically, the fitness challenge is like a 30-day challenge. It's basically monthly. And we wanted to incorporate exercise, healthy eating habits, and mindfulness practices. And this is so that we can keep district families engaged, motivated through the month. And so basically, what we were thinking was some simple cardio, strength training, yoga, all various types of exercises that can be done anywhere, and that is like an accessible way to motivate families to do this. Also, including healthy meal habits, tips, and then just some easy, practical mindfulness practices that can just enhance one's daily stress. So the framework again would be 30 days, but it'd be monthly. And we were hoping to get the participants familiar with the activities. We would encourage them to have a time set to complete these workouts or, healthy meal preps. And maybe we could have a really engaged community. So by sharing our progress or challenges we faced, through this initiative. So
how it works, we were hoping to probably have a sign up for the challenge, maybe through a Google form. And again, they would just follow some daily workouts or nutrition guidelines. And then probably towards the end, they could share how it went, their journeys, or anything in the future that they were hoping we could add. So these were just some examples that we found on the internet. Hopefully something like this, so it'd be easy for families to kind of read and go through. And then we were just hoping finally for you guys to give us some feedback. Akshita, do you want to add anything?
Not really. I mean, as of like results, this is like very like interpretive to like the family or like the student who's doing this. So like they would obviously see some better results in their like overall well-being. But yeah, overall this is like something that we hope to like work on.
Great, thank you. Did you want to talk at all, like I had, when we met, you had mentioned, the Whitney on Wheels program. Was that something that you wanted to get into at this point, or?
Oh yeah, I can briefly discuss that. So for a civics project, as we try to establish a school-based health clinic, like we hope to, we might partner with Whitney on Wheels, which is an organization that also like establishes health clinics. In the past, they've established it in Albany School District and Lansingburg School District. So we hope to bring that similar focus into our district. And why we think that is because as we researched, we've looked at the numbers and of like families under like the poverty line and stuff like that, and we see that although we're not like one of those school districts that desperately needs some sort of like assistance like this, that we are like near close to those numbers. So it would really help that bring a health clinic to just overall help families ease like the the initiative to like get healthcare access and just make it more easy for these families overall.
Very good. Well, thank you. I'll open it up if anybody would like to unmute and ask any questions or make some comments. Got a quiet group today. All right. Well, girls, thank you very much. I would say, we can definitely share this out amongst our wellness committee, and also maybe we could schedule a follow-up and talk a little bit more about some logistics and ways that we can, I can help you with some of the, organization of this, get it off the ground for you.
Okay, thank you so much.
Welcome. All right. So that's it for guest speakers for today. I don't want to put you on the spot, but Lisa and Alex, I don't know if you have any updates from food services that you wanted to share with us?
Well, no real updates. I guess the biggest finger crossed update that we have is that Governor Hochul put free meals for all in her budget for this upcoming year. So we are pretty excited that hopefully it will be in the budget come whenever it's passed in April or May, or hopefully sooner rather than later. So that will mean, a lot to the district, because if we were to reapply, we would have to go back to, a full paying district with the free and reduced meals as we have in the past, based on our enrollment right now at this point. And so it's pretty exciting times. I can't see the legislature at this point saying no to things for something like this. Usually it's hard to say no to kids, but they have done it in the past. So fingers crossed. So that's good for us. I mean, as far as our meals, we're probably looking to do close to 70,000 meals this month. That includes our district and some of the surrounding private schools that we also service, as well as probably we're going to do half as many breakfasts, which is really awesome, because historically we weren't a big breakfast community. And I just looked today, and we're definitely going to be over probably 30,000 breakfasts by the end of the month next week. And certainly if we didn't have Monday and next Wednesday off, we certainly would have broken that record for January. So we continue to feed our students, and of course bring in our other big initiative is farm to school, and partnering up with our new farm to school coordinator. And this time of year, though, it gets tougher and tougher because we live in North America and there's not a whole lot of vegetables to be had. We do have our beef, and we still have cabbages and some potatoes and some kale and some things like that. But for the most part, finding New York produce is hard, as well as pretty much any produce. I don't know what will happen with all those fires now in California, what will happen to the oranges that we usually get this time of year, and some of the lettuces out there that usually come from California. And again, one of our regulations is to buy U.S. Produced foods. So the influx of imported produce for us is not good. So anyways, that's what we do. We feed kids, and we enjoy feeding kids, and we hope that we're extending their palate. We have done a lot of different taste tests this year. We've done Brussels sprouts in the middle school that we really were scared about. We thought for sure there would be Brussels sprout wars, or I don't know, something, but the kids really enjoyed them, wanted to know when they were going to be on the menu and how big the portion was going to be in some respects. So we got a bunch of thumbs up on that. We did a taste test for Casa Visca at where did we do that? Latham Ridge, I think, or Blue Creek. And we just received some of their sauce. So it's made locally here in Rotterdam. And it's a tomato sauce based not only with tomatoes, but it contains some beets and carrots and that type of thing. And the kids enjoy that. It's a little sweeter than I would like personally, but the kids are enjoying that. So we're doing a local tomato sauce. Also, there's a K Foods right here in Albany, down the road. I from what I understand, who we are doing a sunrise waffle, which is a waffle that is made with more than 51% New York State products, and that product is carrots, which they get from Daigle Foods down in Florida, New York. So they're harvesting the carrots, they're turning them into a waffle with some other ingredients, some New York eggs and such. And we have a New York waffle product, and it's really good. And we're actually topping that with crosstown maple syrup, which is a New York maple syrup. So we've really expanded our New York selection of foods, not only, as fresh and as close to Albany here, Latham, as can be. So we're really excited about some of the ventures that's going on. That's really what we're doing.
Fantastic. Love hearing about the locally sourced products. So I did speak prematurely. I did have Jen Moran on our agenda. Jen has a very exciting announcement regarding a grant from the Albany County Award for Tobacco and Substance Abuse Prevention Education. So Jen, do you want me to share, or do you want to share your screen?
I think I could share my screen.
All right.
Maybe not.
All right, I got it ready to go if you'd like.
Oh, that's good.
All right. Okay, it should be popped up now.
All right, thanks, Dave, for asking me to speak. And my name is Jen Moran. I am the elementary health educator for the district. I've been in the position for 2 years now. And I recently applied for this grant through the Albany County Legislature. And I wrote a whole bunch of items that I would like to see for elementary level students. So it's for grades 1, 3, and 5, because those are the grades that I currently teach, mainly because looking at 1, 3, and 5, we were just thinking about getting more health lessons in to create a more skillful, health educated child. So the grant, I did win it for $15,841. And I just came up with this idea, Healthy Choices, Be Smart, Don't Start program. The goal is to prevent substance abuse among students, providing age-appropriate education, definitely making healthy decision-making skills for our kids. I need the next screen, Dave, sorry. So some of the things that were written in the grant were materials from Health Edco, which is an interactive site that has a whole bunch of different hands-on lessons with engaging topics geared towards younger children. I looked into partnering with a curriculum called Too Good, which is used in the area. The Prevention Council uses it to go into schools in Saratoga. It's evidence-based. It really focuses on substance use, violence prevention, and addresses risk factors by building resilience and protective factors in students. I looked into building some professional development for any educators that might be interested, possibly middle school teachers that this program will feed into through Heritage Institute's Drug Education for Today's Teacher, just giving professional development for the people in charge of the lessons. And then I looked into partnering with the Prevention Council. They're a group in Saratoga County that do really great education for their school districts. And I was looking to partner with them. Once we get into the grant, I will see how that can come along for our families and students here at North Colony. There was a part of the grant written for establishing like a mentoring program for children of the elementary level. What exactly that will look like will soon be determined, but hoping to support positive role models with the program's message and encouraging healthy choices. I know there are some school districts that already do some things like that. Also, I think that it does align with the district's mission, you know, to provide a holistic education that supports the growth of our students, both personal and academic.
I think that's
And
set
I
the
think,
last slide.
yeah, just like, yeah, it was just like an overview of, you know, what I wrote it for and what the award was for.
Fantastic. Well, congratulations. That's a lot. And you know, we're excited to see what you're gonna use the money for. And Jen and I and Miss Skeels, and I'm sure some other members of the North Colony School District are gonna be down in the MVP Center next Friday, I believe, for a little ceremony they're holding for all the recipients, the award winners from throughout Albany County. So it's very exciting. Great work, Jen. Pragna, did you mean to raise your hand? I think I see a hand over here.
Yeah. I wanted to let you know that I'm gonna send out a Google form to you, and if you could share that with everybody else, that would be great.
Yeah,
In the
absolutely.
Google form, it basically asks if you want to help out with the 5K run.
Perfect.
Yeah, thank you.
Okay, you're welcome. All right, unless somebody else has anything they wanted to add or ask, I'm gonna conclude the meeting at this time, and as I always do, I'll share this out to everybody that's on the committee as well as post it to the district website. So if anybody out there wants to reach out to me, or I can point you in the right direction if you had a question that I can't answer, and I'll share out these questionnaires that the students have put together for their initiatives. So thank you all very much, and I'll get the information out for the future for our next meeting. And if you or a friend have any thoughts for good things that are going on in our district or our community, or ideas that you were looking to get some assistance with, feel free to reach out to us. Thank you all.